About 100 parents and Tufts Children's Hospital staff gathered outside the facility Saturday to protest its planned closure. The hospital announced the move last month, saying kids' specialized pediatric outpatient care, day surgery, and the neonatal ICU would remain at Tufts, but any kids who require inpatient care would be transferred to Boston Children's Hospital starting in July if state health officials approved. Tufts executives say the change would let them convert the 41 beds in the children's unit to adult care, noting they've been turning away dozens of seriously sick adult patients each day, while they say its pediatric inpatient unit is usually only half full. But many parents and staff say the switch is nowhere near so simple, and as of this taping, close to 64,000 people had signed a petition calling on Tufts to save Tufts Children's. Joining me are Mary Havlick Cornacchia, she's co-chair of the Massachusetts Nurses Association Union at Tufts, and Amanda Crowley, a parent of 3 children who've been treated at the hospital and co-founder of Mending Minds Foundation, aimed at figuring out why and how young kids develop certain diseases. We also invited Tufts CEO Dr. Michael Tarnoff to join us. He was unable to do so today, but indicated he might be willing in the coming days. And a spokesperson sent a statement that reads in part, "Our intent is to ensure that children will be able to continue to see their same doctor, care team in the same clinic with their current insurance. We remain committed to supporting our communities and families with the same high-quality, compassionate care they've come to expect and deserve." Amanda and Mary, thank you very much for your time. I really appreciate it.
Thank you.
Mary, thank you. Can I start with you, Mary? What concerns you most about this the decision?
We're most concerned about the children and their families. Tufts serves an underserved population. We accept all kinds of insurances and even no insurance, and we don't turn away children. That is not the case at Children's Hospital. They are selective in the type of patients that they do care for. And we're just worried that the number of people that we serve in our community will fall through the cracks.
Amanda, I know for you it is very, very personal. Can you describe why this matters so much to you?
This is a lifeline, a crucial lifeline to so many families like mine. We were completely blindsided by this announcement, and honestly, we're scared and we feel stranded. We're dependent on Tufts for a very specialized kind of care for really complex kids. Tufts is known for having teams that work really well together and treat very complex illness. And for my kids who have a diagnosis of PANDAS, which is a pediatric autoimmune neuropsychiatric disorders associated with strep, you know, this is a medical home for this condition.
And Children's Hospital, from what I understand, does not provide the immune therapy for PANDAS that Tufts does. Is that correct?
That's right.
So what do they say to you, assuming that they go ahead with the shutdown of the inpatient beds? What do they say you should do and your children do?
We have a lot of questions right now. We don't have answers, and you know that's where we're stuck right now. We're you know, this is terrible timing. We're in the middle of a pandemic. Families are in, you know, extreme crisis already, and then to lose access to critical care is just unfathomable. You know, it's unconscionable.
Amanda, if I can stay with you just for a second, I know I read that all 3 of your children suffer from PANDAS, your middle kid in particular. It's hard to ask this question, but what happens to your middle son if this move happens and there's not replacement therapy?
Well, like my son and hundreds of other kids who are diagnosed with PANDAS, but other immune deficiencies, other autoimmune conditions that depend on this kind of specialized care, we don't have another place to go. 5 months or less than 5 months gives us no time to find another place to have our children treated.
And what would happen to your kid if the treatment was not available?
I don't know. I'm scared.
You know, Mary, you mentioned the insurance thing, and I'm sure you've read the quotes or heard the quotes from Dr. Churchwell, who runs Boston Children's, and a spokesperson says if there are gaps in coverage, we'll work with those insurers to cover those children, as we always do. And he goes on like that. It was in the Boston Globe. Do you not believe them, or you're not buying it, or what?
So we have true concerns, Jim, and mostly because we see the children that Children's turns away. We treat them in our emergency rooms. We admit them to our inpatient facilities. Right now we're experiencing a dramatic pediatric mental health crisis. We admit those children and we care for them. It's not a psychiatric facility, but we don't turn them away and we don't make them languish in emergency rooms waiting for beds. We take them in, and that's a huge concern. It's a big problem right now.
Mary, when people, assuming that Tufts Children's does make this change, and they are turned away from Boston Children's Hospital, as you suggest, and we will reach out to them to hear from them as well, what happens to those kids?
That's a great question. I know that Mass General has a pediatric facility, and so does Boston Medical Center, but we take on patients from those facilities also. We're a feeding hospital from Lawrence and Lowell. There aren't enough beds around, and we provide a resource to a large number.
Mary, again, I said in the beginning, in the introduction to both you and Amanda, that the hospital, the Tufts, is saying we don't fill nearly all of the children's inpatient beds, and we have a demand that far exceeds the number of adult beds. Is that true from your perspective?
So, administration works largely in the law of averages. Up through last week, we've been full on the pediatric side. We were short 2 patients of full on Friday. And our pediatric staff has been putting in overtime to meet the demands of the census on our pediatric side.
So what do you think is behind this, Mary? You work there. What's the agenda?
Oh, I do work there. And, Jim, we, as a union, we meet with administration on a monthly basis, and we've had conversations about census over the last years. But this closure was never tabled. So it was a blindsided move to.
But why are they doing it? I'm trying to ascertain if it's going to. Why are they doing it from your perspective?
So from my perspective, we offer an awful lot of resources. And I think that the hospital is just not feeling like they see enough volume in every kind of resource that we offer that makes it a marketable and manageable thing to maintain.
Can I translate that? Are you saying they're doing it because of the bottom line? I don't want to put words in your mouth, but I want to understand. Is that what you're suggesting?
It feels like that they're putting dollar signs on children. Yes.
Well, Mary, staying with you for 1 second, what I don't understand, and I don't know enough to, obviously, I'm just know what I read and speaking to you, and hopefully we'll get to speak to Dr. Tarnoff soon. They're not closing outpatient services. They're not closing the newborn ICU. If money was the primary issue, why would they not be closing those
here's
services?
our fear. Here's our fear, Jim. These physicians that were also blindsided, a number of them were. The hospital's expecting that it's going to be a smooth and collaborative transition to Children's Hospital, and that is not going to be the case.
Why?
Because there are physicians that are choosing not to go to Children's. They're choosing to interview at other facilities or even moving away from the area. So, what Amanda mentioned, we have critical teams that are resources to these families, many people involved in the care of these children. And it's not going to be an easy, let's just pop them in the car and drive them to Children's on July 1st. And the hospital will tell you that they've thought this out. It's going to be a process. It's not just going to be a drop off and drive by. But the fact is, they're counting on things happening that just don't look like they're falling into place in in the manner that they think that it will.
Amanda, how, almost every question I'm asking you, I hesitate because I have kids too, and I obviously, they can tell by the look in your face and your voice what this means to you. Do you have hope that this can be resolved? I mean, you've put a lot of trust in Tufts in the past. Do you have any trust going forward that they'll listen to you and the 64,000 people who've signed the petition and Mary and revisit this?
I think we have to fight for this. You know, we have to get our voices heard. I'm willing to meet with whoever would like to meet. I represent, you know, I'm here on behalf of, you know, thousands of families from Tufts. I mean, there's families who don't have a voice here right now. I was speaking to a mom who has 15 specialists for her child and works 2 jobs as a single mom. I mean, how is this going to happen? You know, how are we going to transfer, you know, our case is complex enough. How is somebody with 15 specialists going to make this move seamlessly? I mean, it's just impossible. And the timeline is so short. You know, this just happened so quickly and unexpectedly.
Let me just say, considering the potential human cost here, I hope that Dr. Tarnoff will see fit to join us here, to Dr. Churchwell as well. And I surely hope that they'll both see fit to meet with you and others. So I thank you very much for telling your story tonight, and I wish you a lot of luck. Amanda and Mary, thank you.
Thank you so much, Jim. We're so grateful.
Thank you.